1. A nurse is caring for a client with a potassium level of 2.9 MEq/L. Which assessment finding is most concerning? A. Muscle weakness. B. Abdominal distension. C. Cardiac dysrhythmias. D. Decreased bowel sounds. Correct answer: C. 2. Which client should the nurse assess first? A. Client with chronic back pain rating pain 6/10. B. Client with asthma and wheezing. C. Client scheduled for discharge. D. Client requesting a sleep aid. Correct answer: B. 3. The nurse is administering insulin Lispro. When should the nurse expect peak action? A. 15 minutes. B. 30 to 90 minutes. Circa 2 to 4 hours. D. 6 to 8 hours. Correct answer: B. 4. Which action best prevents catheter-associated urinary tract infections? CAUTIs. A. Emptying the bag every shift. B. Securing the catheter to the bed system. C. Irrigating the catheter daily. D. Maintaining a closed drainage system. Correct answer: D. 5. A nurse is teaching a client with heart failure. Which statement indicates understanding? A. I will drink fluids whenever I'm thirsty. B. Will stop taking meds if I feel better. C. I will weigh myself daily. D. I can eat canned soups freely. Correct answer: C. 6. Which laboratory value requires immediate intervention? A. Blood glucose 52 mg per deciliter. B. Hemoglobin 14 grams per deciliter. C. Sodium 138 MEq. LDWBC 8000 per millimeter. Correct answer: A. 7. A nurse is caring for a postoperative client. Which finding indicates A. Possible infection? A. Pain at incision site. B. Temperature 101.8 degrees Fahrenheit, 38.8 degrees Celsius. C. Clear drainage. D. Decreased appetite. Correct answer: B. 8. Which intervention is appropriate for a client experiencing hypoglycemia? A. Administer insulin. B. Restrict carbohydrates. C. Encourage exercise. D. Give orange juice. Correct answer: D. 9. The nurse is administering morphine. IV. Which assessment is the priority? A. Pain level. B. Blood pressure. C. Respiratory rate. D. Bowel sounds. Correct answer: C. 10. Which client is at greatest risk for aspiration? A. Client with stroke and dysphagia. B. Client with GERD. C. Client with hypertension. D. Client with diabetes. Correct answer: A. 11. Which position is best for a client in respiratory distress? A. Supine. B. Trendelenburg. C. High Fowler's. D. Side lying. Correct answer: C. 12. A nurse is teaching about infection control. Which action breaks sterile technique? A. Wearing sterile gloves. B. Turning back to sterile field. C. Using sterile drapes. D. Keeping hands above waist. Correct answer: B. 13. Which symptom is expected in a client with hyperkalemia? A. Muscle cramps. B. U waves on ECG. C. Shallow respirations. D. Bradycardia. Correct answer: D. 14. A nurse should withhold digoxin if which finding is present? A. Apical pulse 54 BPM. B. BP 140/90ths of a millimeter of mercury. C. Respirations 20 per minute. D. Oxygen saturation 96%. Correct answer: A. 15. Which client statement indicates A. Need for further teaching about antibiotics? A. I will finish all my medication. B. I will stop if I feel better. C. I will take doses on time. D. I will report side effects. Correct answer: B. 16. The nurse is caring for a client with a chest tube. Which finding requires immediate action? A. Gentle bubbling in suction chamber. B. Drainage of 50 milliliters per hour. C. Chest tube disconnected. D. Client coughing. Correct answer: C. 17. Which intervention reduces risk of pressure injuries? A. Massage bony prominences. B. Reposition every 2 hours. C. Limit fluid intake. D. Keep head elevated constantly. Correct answer. B. 18. A client reports chest pain radiating to the left arm. What is the nurse's first action? A. Give morphine. B. Obtain ECGC, check vital signs. D. Call family. Correct answer. B. 19. Which medication is an antidote for opioid overdose? A. Naloxone, B. Flumazenil, C. Atropine, D. Protamine sulfate. Correct answer. A. 20. Which finding suggests fluid volume overload? A. Dry mucous membranes. B. Decreased blood pressure. C. Crackles in lungs. D. Poor skin turgor. Correct answer. C.